So we'll give a few minutes for folks to get on here because we're live, and we're just gonna watch the folks come in and here for this kind of rough conversation today, but that's okay. We're fully prepared for a difficult conversation with one of the best people to have that difficult conversation with. So we're very lucky. I see you guys logging in. I see people are showing up. Make sure you're posting your questions in the comment box. Dr. Dani is here to answer them. We're here to have a great conversation today. So we'll get rolling here as people are coming on in. So surprise, I'm here, Cat Coach Beckie. I know this is usually Dr. Chris. So it's going to be me this time, and I hope you guys are okay with that. I'm excited to see you all. Tell me who's here. Say hello in the chat box, and I'm really happy to introduce to you guys today one of the most amazing women I know. Honestly, just a female entrepreneur in the first place, right? Which we absolutely love, but somebody who has really harnessed her strengths, despite, what a lot of people kind of find to be the quote unquote worst part about what we do. Dr. Dani McVety has made it actually the best thing we do, and recognizes that it can be the best thing we do. So, Dr. Dani, welcome, and thank you so much for being here today.
Thank you, Beckie. I'm honored to be here with you.
So for our folks that maybe don't know what Lap of Love is or how you got here, because I love your story and just how you recognize your strengths. So we gotta just share it.
Yeah, gosh, this goes back to 2009. And I'd just graduated veterinary school. I also graduated in an economic collapse. So a lot of the jobs that were supposed to be available did not end up being available during that time. And it was definitely a difficult time, not the best time to have graduated.
Yeah.
So anyways, I was doing emergency medicine. And if you know anything about veterinary medicine, the first thing you could probably find when you Google is high student debt load. So I thought, you know what, I really want to do something. And I love emergency medicine. Like even now, I just love it so much. Yeah. And I needed something to supplement my income, pay back student loans. And so I decided to obviously kind of harness a strength that I was finding that I had. I didn't know when I graduated that I had this strength, but in emergency medicine, sometimes we're having conversations with families that go something like this. You know, we have the option to either spend about $500 to $2,000 of your money right now to try to get to the bottom of what's going on, or we need to discuss euthanasia. And the only wrong answer is doing nothing. Yeah. So helping people through that decision-making process and what do we do? Why are we going to do it? How are we going to do it? Why? I took so much pride and I really enjoy taking emotions from this, kind of down into something that's digestible and understandable and then like very subjective, about, or rather objective about a subjective topic. So I enjoyed doing that. And really what I decided to do one day was just go to somebody's home for a euthanasia. And it just developed. And I found myself tapping into human hospice volunteer work that I did when I was in college. And it's such an amazing organization. And they focus on the patient. They don't focus on the disease. It's right. What you want. Do you want to take your medication? Would you like ice cream today? It doesn't matter if it exacerbates a problem. Like, what do you want? We just want you to be happy. Yes. And that's what veterinary hospice was to me. And that's what it grew into. And then, of course, a huge part of that in veterinary medicine is euthanasia. So now we do hospice care, which is about the conversation, and then the euthanasia, which is the majority of what we end up actually physically doing, is obviously the way that, that most people tend, to want to say goodbye to their pet. So
oh, sorry, go ahead.
No, I didn't even answer your main question, which is how did we get here? So then now, 11 years later, Lap of Love Veterinary Hospice was supposed to be just my little part-time gig, but about a year later, Dr. Mary Gardner, was so blessed to have her come on as a partner in the business. And then from there, we grew it. We have over 120 doctors, close to 130 doctors that work with us now. We help between 5,000 and 7,000 families per month. That's per month. Yep, around the month.
And that is world-changing, right? That's life-changing. That's creating the best experience because the outcome is inevitable, right? It's about that process and really being able to have peace with the process. And you guys have really just rocked that.
Yeah. And if you talk to doctors, the first thing that somebody says when I come into the home, the first thing they say is, this must be awful. You must hate this. This must be the worst part of your job. You must you must hate doing this all day long. Or they look at me like, how do you do this?
Yes.
And if you ask any doctor that works with us, anybody that helps us answer the phone, and any human hospice nurse or doctor that does this, they're going to tell you the same answer, which is, it is an honor to do what we do. And it is fulfilling in a way that you either get it or you don't. And that's fine. You don't need to, there's fulfillment in knowing that there's a finality, to your point, to what we're doing, that there's no more questioning or wondering. When I did ER, it was always like I would literally, you guys, wake up in the middle of the night, or in the middle of the day rather, and worry, like, did my patient make it through? I had to transfer them back to their general practice, and you don't hear anything. There's no follow-up. But in euthanasia, there is this closing of a chapter. And when you do that well, you prevent therapy for the rest of their life. You prevent somebody from hating to get another pet. And my favorite compliment is when someone's like, you made this process beautiful, and now I'm not afraid to get another dog or cat. Like, to me, that's what saving the world is all about, is opening your heart and home to that next pet.
Yes.
And loving look, none of us are getting out of here alive. None of us.
No.
Right? And our pets' only downfall is that they don't live too long. That's it.
The worst. Yes.
When we take, and to your point, you said this, I mean, and I'll tell you too, as a veterinary nurse, as as a doctor, the process of euthanasia is not a difficult one technically, right? A couple injections, that's not difficult for us.
Right.
The art behind the communication and the etiquette and what you say and what you don't say, that is what makes the difference between giving euthanasia and giving a peaceful, beautiful end of life experience. And that's our product in veterinary medicine, is the honoring of that experience.
It's so true. Anytime anyone finds out I'm in veterinary medicine, like on a plane, euthanasia is the first thing they bring up, and that say, I just could never do that.
Yeah.
And I feel very similar. I say, I understand that, but for me, it's an honor for peaceful passings. And I think peaceful passing is the part that is concerning for everybody if they don't necessarily understand the process of euthanasia. Right. So I understand I've had clients who say, I would never do that to my pet. I would never make that choice. And they almost see natural death, even if it even if it involves suffering,
right,
as the better passing. So can you speak a little bit to just that point in general, and how we help our clients understand scientifically, medically, physiologically, and emotionally that process?
Yeah, and that's such an important topic. In my opinion, when people say that, when they say, I just want him to pass naturally, I don't think that they know what they're saying, to your point. Like, I don't know if they completely grasp what they're saying. Now, before we go into this conversation, let me preempt this with one very, very important point. There is nothing wrong with natural or unassisted death. There's nothing wrong with that. And I know that nobody in veterinary medicine is going to tell you there's anything wrong with that. What we're only saying is the fact that sometimes, not always, but sometimes we have a choice to make the experience of euthanasia a very peaceful one. And it's just like the choice to have an epidural through a childbirth, right? Sure. Childbirth is going to happen whether or not you have an epidural or not. That baby's coming out. Right? I know this, okay? Actually, I'm pregnant with the fourth right now, which is crazy. So I know that.
No, congratulations.
Thank you. Circle of life, right? Circle of life. So the epidural is a choice. It's a choice that you make. And it just simply makes a process that's going to happen anyway just a little bit less painful. So there's nothing wrong, because I had my first two children without anything at home on purpose. So I have such respect for the natural process coming in and out of this world. So you don't have to have euthanasia. And there's nothing wrong with not having it. Just the point is that we make a process that is not going to be painless, you guys. Mother Nature did not design death to be painless. And it is, depending on the disease process, it could be sufferable, and that could be sufferable for hours to days, or it may, very rarely be something that the pet just goes to sleep and doesn't wake back up. But listen, if that was the case, I would say absolutely go do that for all of them. But it's not. And I'll say one more thing about this natural passing. Bulldogs aren't natural. Okay, Sphinx cats aren't natural. There's nothing natural about what we have done to our breeds of animals. And there's nothing wrong with that. Listen, I had a hairless dog. I love hairless dogs.
Yes.
But, it's just simply the way that it is that we can't expect this process to be perfectly natural. And everyone has their own thoughts and beliefs and religious opinions about it. And I honor all of them. There's no right or wrong answer. All we're talking about here, and this is the communication that I have to my families, which is you have a choice. All right. There is a point of time in which you have a choice. And if you wait too long, that choice will be taken away from you. And you will be at the emergency clinic at 2 a.m. because your cat is screaming in pain.
Yes.
Okay. And that most likely will happen in many cases. Okay.
Yes.
But if you desire a peaceful end of life experience, then that's something that can happen if you make the decision just a titch sooner than you want to. I know we all want to wait till the very end, and we can talk about that in a little bit too, like the trends that we've seen. But that's really, at the end of the day, that's the communication that we have with families, which is we are about a peaceful experience. And one of my favorite quotes is, it's better to help a friend a day too early than a second too late. Because, right? Because that's why, and I tell people, I'm like, that's why I started this company in the first place, is so that you don't have to rush to the emergency room at 2:00 in the morning. Because I know what happens when you have to do that. So that isn't always the best option. So that's kind of like the emotional and psychological process of euthanasia. And really kind of, if you look at it holistically, it's about accepting the whole process of death. And it's about accepting this process that's going to happen, whether or not you plan to step in. I think a lot of us as owners and pet parents, we think that we have to make the decision. You don't have to make the decision. If your cat has congestive heart failure, that decision has already been made long before, you ever even thought about it. That death decision has already been made. Now, the process of dying, how, when, where, whether or not we're going to be stressful before we pass away, that's again, something that you get to be a part of that decision-making process at the beginning. If you wait too long, again, that's going to be taken away from you. But so back to the actual, what happens during the euthanasia, because I think that this is super important to be prepared for. Typically what happens, and I'm going to preempt this with, there are some situations where maybe a condition is going downhill so quickly, or the pet is just in a disease state that may require us to change a little bit. But the vast majority of the time, so 95% of the time, we give 2 injections. The first one is a sedation injection, and it's given under the skin or in the muscle, which looks like it's just under the skin. And that has a mixture of medications that we use based on your pet's condition. So sometimes we use a little bit more, sometimes we do less. And we want to your cat to be very calm and comfortable, right? That's the whole point, is just to calm down, relax. And then at that point, it's really sometimes it's the first time that the owner has been able to see their cat comfortable and relaxed and out of pain or not breathing, difficultly. So that's the first step, is a sedation injection. And that's, again, a cocktail of many different medications based on the doctor's preferences and the condition of your pet. And then the second injection is one drug. There's many different brands, but it's all one drug, which is sodium pentobarbital. And that injection is typically given in a vein. Although I will absolutely tell you that the vast majority of doctors that do this for a living have chosen to give that second injection intrarenal in most cats. It's a new process that I learned about 8-9 years ago, right after I started Lap of Love. And it's so the cat is lying on his side, his or her side, typically on your lap. Hopefully, that's why I called it Lap of Love, because you want to be on your lap. And then we give the injection literally through the side, like kind of right below the ribs, and it goes directly into the kidney area. And the kidney area is very, very, very perfused, which means there's a lot of blood flow that goes through it. And what that means is that medication gets taken up to the brain very, very quickly, even if there is chronic kidney failure. And it's incredibly fast and rapid, and it's more rapid than an intravenous injection, like an IV. But if for some reason your cat is not, of course, most of the cats we see are very, very skinny. But maybe 30% of them aren't, because there's other conditions that are going on. But if the cat's well fed, then we will go on a leg vein. So it's important to understand that us doctors that do this for a living, we are the ones that A, teach other doctors how to do it, but B, we have other options available to us other than just going in a vein, which is what you're going to see most doctors in the clinic do.
What a good point that, we look to specialists in so many aspects of our lives and in our pets' lives, right? Like if my pet needs rehabilitation, I'm going to go to a specialist. If my pet has a heart condition, I'm going to go to a cardiologist. I'm going to have a neuro check, whatever, I'm going to look for people who are really well qualified and experienced in what they do. And even if you've done 4 million euthanasias throughout your veterinary career, if you've always done them the same, then you're like, you still just have the same toolbox, right? So I love that you're talking about we can actually learn and advance end of life decisions, and that we can bring the best medicine to that to make sure that it's even better than we could make it. That is fascinating to me. And as a veterinary technician who is generally placing the catheter in tiny little potato chip cats, the idea of just like, Mom, you just pet the head. We haven't gone through that process. You didn't have to watch them squirm or any of that. I think this is beautiful. And I want people to understand that there are other options, and it's worth talking to your veterinarian about. And being at home can bring such a lower stress level to the whole process in general. Like I always think about the owners and the parents who schedule euthanasias. I've always lost my pets in acute situations, like in an emergency situation, and had to make that decision, as opposed to, okay, we know Friday it's going to be the day. And I think that it is important for people to know that that is an option, and that it can be at home, it can be peaceful. So I think it leads us to our natural next question, Dr. Dani, is how do we know when it's time?
Yeah, that's the biggest question. Right? And I do lecture for 2 and 3 hours straight just about this. So we'll sum it up into a couple minutes. How's that? So it is so difficult. And I'll start by saying that there is not one moment in time in which it's the right decision, and before which you're going to hell, and after which you're going to hell. Like there's not this one moment, but there is a subjective period of time in which euthanasia is a good decision. And it may not be your only decision, but it's a good decision. And before which, as a veterinarian, we're going to refuse to euthanize because there's good quality of life. And then after which, as a veterinarian, we're going to insist on euthanizing because there's sustained suffering. Yeah. So this happens in the emergency room. This typically doesn't happen with people that would be watching this webinar, because these people don't typically have a connection to their pets. Okay. Right. So this bigger question is, what about the subjective period of time? Some people like to push the boundaries, and they want to go to the very, 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 very end. That, again, you're going to risk that decision being taken away from you, and you're going to risk peaceful experience. Some people like to do it at the very beginning, and these are the people that have been through it a lot of times. So going back to the trends, one of the very interesting trends that I didn't think that I would see is that people that are going through the loss of their pet for the first time tend to wait until the very, very last minute. And that's not necessarily my opinion, but that's rather what they tell me afterwards. They say, I waited too long. I should have done it sooner. Because you're waiting for that right moment. And if you wait for that right moment, it's like deciding to have a kid. Don't wait till you're ready to have a kid. You're never going to be ready.
Right.
You have to have your gut feeling, and you just have to listen to the people around you, listen to the experts around you, and say, you know what, this is a good time. And you also really have to take some direction from your veterinarian. And look, to your point, there are specialists in this field. I am not a dermatologist. I don't like dermatology. I don't get it. It bores me. I don't know why I can't give them all steroids. And that's just, so I choose not to do that. But there are some veterinarians that aren't good at this conversation. They might be good at it, but maybe they don't take the kind of pride that we take when you're a hospice veterinarian. Yeah. So my point is, it's okay to talk to your regular veterinarian about this. And then if you need a little bit more, you're like, I just need more meat to this conversation, reach out. Google hospice veterinarian in your area. Google mobile veterinarian if there are no hospice. Try to get somebody that can come to your home or just talk to you on the phone. And there's tons of services around, not just ours, but there's lots of services around the country that will just talk to you about this. And the reason I'm telling you need to talk to a veterinarian is because the disease process that your pet has is extremely important. You cannot wait until that last moment with a pet that has congestive heart failure. The heart will work until the second it doesn't work. And your pet will look okay until the second that it doesn't look okay. So you have to understand what disease process you're dealing with. If you're dealing with, chronic renal failure, like we do in cats a lot, that is, you know, I say to those families, you have the blessing and the curse of time. You have the blessing that you will continue to go on for weeks and years sometimes with chronic renal failure. But you also have the curse of time that every day you're going to be looking at your cat and thinking, today. So, you know, there's two more things I want to say. Number one is know your budgets. All right. So there's 4 budgets that we talk about. There's the emotion. I'm sorry, I'll start with the most obvious. The financial budget is clearly, you know, a budget that all of us can understand. And if there's a chance that you can, you know, get your cat through another 1 to 2 years, but you need to spend $1,000 a month, like not a lot of people are able to do that. And that's valid. That's fine. I mean, honestly, people that came into the ER and said like money is no option, do anything and everything you can. Those are sometimes the scariest cases to me. Because I'm like,
they're not paying the bill.
well, yeah, you worked at a clinic long enough to know that. But also sometimes like if they do, like even if you had $1 million, I can't save your pet. Like this isn't, you know, so sometimes those are very nerve-wracking for us because we don't know what else, you know, to do. So, so financial budget, then there's an emotional budget. So let's say your cat belonged to, you know, a deceased spouse, and now your spouse died a couple years ago and now you're losing your cat again. So in essence, you're not just losing your cat, you're losing your spouse again, or a family member, or a child that committed suicide. This is their pet. I mean, name it. I have seen it, heard it, felt it. I mean, there was this one woman who she was in an abusive relationship and she collected cats. That's what she told me. She goes, that's how I got through this. He got thrown in jail and now she had a bunch of cats and her home was being foreclosed on. And, you know, we had to discuss and decide what we were going to do because emotionally, financially, she couldn't take these cats with her to the next place. So, you know, people tell me these things and, you know, it's difficult. So there's an emotional budget as well, right? Of understanding what you can handle. There's also a physical budget. I mean, I had a client who had a cat that needed diabetic injections once or twice a day. And she actually had arthritis in her hands and physically couldn't do it. So now the cat was deteriorating. Oh, and not only that, but your cat's running away from you every time she sees you. Now there's no relationship anymore, right? Like, what's the point? If you're scaring your cat with just your presence, like that's sad. That's sad for everybody.
Yes.
And then the last one is the time budget. You know, so I mean, I've worked with people that are like, look, I can afford the insulin, but I don't have the time. I'm a single mom working 2 jobs, and I just don't have the time to do this. You know, this nursing care is a lot. So it's important to understand that besides financial, you know, there's emotional, physical, and time budgets that come up that they're all valid. You know, they're valid reasons to push that needle a little bit earlier. You know, so everyone's going through things. The last thing I'll say is quality of life scales. So there's a bunch of quality of life scales out there. We have a few on our website at lapoflove.com. You'll just see quality of life scales at the top. But it's important to understand that you have to pick a quality of life scale based on your personality. So some people need like an algorithm, right? That's going to spit out the Excel spreadsheet and, you know, tell you yes or no. I just want to know yes or no. And then some people need something that's a little bit more subjective and ongoing. So you might need to have a calendar, right? And then you put an X on a bad day, you know, and leave the good days clear, and do a half an X on a kind of sort of, you know, bad day. And I always thought that'd be a good thing for dating. Like you should have a quality of life scale. Right? I know, right?
I'm like, hey, we just started a business. We're copywriting that. Nobody's stealing.
Yeah, exactly. So anyway, you know, it's important to find something that works with you. Penny in a good jar, you know, penny in a jar for the good days and a penny in a jar for the bad days, and just to keep your mind going. But at the end of the day, you need to think about what you want for your pet and the disease process. Let that guide you. Let your veterinarian guide you on when is going to be the right time. But the right veterinarian is going to give you a window. You know, you've got the subjective period of time, but the right veterinarian is going to say, based on your personality and what you're going through and your pet's disease process, we need to narrow this window down so that you know where you're falling. Yes. And that's really our job as hospice veterinarians, to help guide that process.
You know, I love the mentality of that hospice veterinarian, because I think a lot of times we fall into the kind of, I know we don't do at all costs like human medicine, but I think we want to fix. Let's try one more thing, you know, because we want the clear conscience. We did everything that we could, because we want to look at you in your eyes and tell you, you did everything that you could. I know we did. We tried everything. So I think that having a lot of reality, and I love your 4 budget bank, that makes so much sense. I also love the quality of life skills, and I really encourage everybody out there to check them out. Go to lapoflove.com. I will put up the website so you guys can follow those scales. I see a lot of people popping up in the comments saying, I'm making this decision now, or I just had to make this decision. So if you're looking for some tools, I think that's really important. Are there other tools you send people to we haven't talked about yet?
Those are the most important tools. We have a bunch of videos on our website also.
Great.
And there's both myself and my business partner did about a 45-minute, separate videos. And her and I have different ways of delivering information. So it's good to watch them both about how do I know when it's time. So those, and then there's some articles that we've written also. I mean, even information, what about an aggressive dog or a behavioral issue, with a cat? I mean, there's all kinds of things that we've written about. I'm actually writing a book. It should be done by the beginning of next year that kind of encompasses all these things too. And I have a bunch of stories in it that help relay, situations that we go through. So, and
three kids, you're having a baby and you're writing a book. Dr. Dani.
Why not? Why not? Yeah.
I'm running this amazing business. Sorry, you just mentioned it and I want to go back to it, behavioral, because that becomes major, hard emotion, right? So what do you talk to clients about there?
Yeah, I know. And it's an important topic. So let's talk about just cats, because in dogs, it's typically aggressive dogs.
Sure.
And that can be the case in cats sometimes, but typically in cats, the vast majority of the behavioral issues that we see are something like urinating outside the litter box. So I'll tell you a story, and this is a true story, as all my stories are true. These really did happen. There was this one gentleman that I helped, and I walked into his home, and he handed me a stack of papers. It was about this thick. And he goes, I have spent $30,000 on this cat. He goes, I spent $30,000. This cat was like 7 or 8 years old. I spent $30,000 on this cat, and he continues to urinate outside the litter box. He goes, I've flown him to New York to see specialists. I've flown specialists down here to see him in the home, to look at the home. He goes, urinalysis, blood work, anything you can think of, I have done it. And this guy was so stoic. I mean, when you talk about compassion fatigue, to me, what he was experiencing was compassion fatigue.
Yes.
Because he had cared so much for so long and he was a single gentleman, a business guy. You could tell he could afford all this. It was a nice home. And he was done. He was just emotionally done. And he's like, I don't know what else to do. He goes, I'm not dropping my cat off at a shelter. I've had him forever, his entire life, since he was 8 weeks old. I love this cat. I just can't function with a cat that's urinating outside the litter box 5 to 10 times per week. Yeah. And I have talked to rooms full of veterinarians and veterinary teams and nurses and practice managers and people that dedicate their lives to be in the veterinary space, because we sure as hell didn't do it for the money, right?
Yeah.
So we're all here because we love animals. And I've asked rooms full of people, how many of you would be okay with a cat that urinated outside of the litter box on a regular basis? Right. 2 or 3 will raise their hand. That's 2 or 3 out of veterinary field, right?
Yes.
So my point is that, it's so easy for us on the outside to judge these people. And it's so easy for you to put a little comment on a Facebook post that says, how dare you give your cat away? And how dare you euthanize your dog for aggression? And you should have adopted him to a ranch in Idaho that puts them out and never, it's not realistic, you guys.
Yeah.
And not only that, but how many cats and dogs are euthanized every single day in shelters simply because there's not enough room?
Right.
So
yes.
The problem isn't that. The problem isn't the fact that someone is giving up. The problem is the fact that there are so many animals out there. And as a society, we need to decide how to deal with them. But that's totally separate. So back to this situation. It is okay. He tried, right? I'm not talking about euthanizing something that you haven't tried with, because I have left with live animals on my lap because I talked the family into letting me try, and I've done that because a lot of times people are just done. They're emotionally, remember the budgets, they're done. And I can't ask that family to continue to keep that dog or that cat. So I have left with animals on my laps before. Now in these situations, however, again, you just can't expect somebody, nor can I, live with a cat that urinates outside litter box. So that's an example of a behavioral issue that just simply it's not conducive to life in a home. And we have to respect that. And I take a lot of time with these people and trying to help them understand that what the decision that we're making, albeit it sucks like terribly, it is still the best option that we have at this time.
Yeah. So we can take steps to try, but we can also have peace in knowing there are sometimes things, wires are just crossed, or things are going on that they're not okay, and that the peaceful passing is better than living in a stressful way, because it's not their natural instinct to go outside of the box for reasons too, or for these behavioral aspects, or these, they're kind of suffering too, right? Like when things like that are going on. And so it really comes down to quality of life. So I think everyone on here, obviously, because these are the world's best cat owners, but can you just speak a little bit to quality of life as like what it really means? Because I do think that what happens is, okay, so I'm honestly talking about like, asking for a friend. Like, I have a 13-year-old dog who has one leg, and it's easy to see her slow decline, but that's her daily, right? And so it kind of, because we move slowly with them down the hill, sure, if I think back to when she was 2 years old, definitely not that dog. But what is quality of life, and how do we, outside of these scales, like what can we expect to be assessing?
Right. And that's the right question to ask, is what do we expect? Yeah. And with a 13-year-old dog, you expect things to slow down a little bit. Look, when I'm 95 years old, I'm not going to go fetching balls like I
am not sure. I would not say that about you. I think you will be doing just that, but the average individual would not.
So funny. I love it. So what are your expectations? And if you have a 3-legged dog, that's beautiful. And little tripod's not probably going to be getting around, the same way that they did when they were younger. Yeah. So, it's about working into those 4 budgets, and also about working in the pet's personality with the disease process, with your expectations. Yeah. And then in that sense, you get to hone down that bracketed time, on when you're going to, have that decision made. So quality of life is really, at the end of the day, what the scales are about. It's what the budgets are about. It's what making the decision is about. Now, I will tell you that quality of life, again, it's, are you interacting with your pet? Does your pet want to be with you? I mean, if you guys are all cat owners, like, hell no, they don't want to be with me because they're a cat. They don't want to be with me. Right. But that's fine. But do they not want to be with you in a very consistent way? Yeah. So, I mean, it's such a big conversation. And I think all the little tiny things that we've already talked about should point people in the right direction as far as what really is your pet happy. Right. And at the end of the day, that's what it is about. Is your pet happy enough? And not only that, but is the foreseeable future happy enough? Yeah. And I will tell you that quality of life is obviously something that we talk a lot about. There is also this space to talk about quality of death. Okay. So as soon as, quality of life runs up and quality of life is no longer there, or we're concerned about it soon no longer being there, then we start talking about, I want to ensure a quality of death. And really that's where euthanasia comes in, is, look, quality of life is now questionable. So we're going to make this decision so that I know that this experience of exiting this world is as peaceful as it can be.
It just makes my heart sing. You are amazing at what you do. Okay, so there's no way to kind of go into this softly and gently, but in making these decisions, and when we come to the decision to make the decision, there are so many things we can do to honor our pets post, right? Like the days of all the things. Okay, tell us, what are our options? There are so much creativity. What are you telling people about?
Tons. Okay, so the very first question you have to ask yourself is, what do you want to do with the body? Okay, so that's the first question. And you're going to want, ideally, you would like to know that, right, at the euthanasia process. So there are 3 major options. I'm going to talk about other options in a little bit. There's private cremation, where they're cremated alone, and then you get the ashes back in an urn. And most of the time that urn can be, you can put the bag of ashes that's inside the urn into a different urn, or you can scatter them around your home, or, whatever fits your family. There's also a communal cremation. These are for the people that don't want to bury at home and don't want the ashes back. Communal cremation, they are placed with other pets in the crematory, and then they're cremated together. And then those ashes are typically scattered at a butterfly garden or scattered at sea or whatever the crematory does with them. They're all a little bit different. And then, of course, the third option is burying them at home. And I grew up on a farm, so, we had a graveyard in the back, just what we did. So those are the major ones. Now, when you talk about memorializing, there's a lot of crazy, interesting, awesome things that we've seen. I have seen people freeze dry 2 cats. So I've had two clients freeze dry their pets. And that's very interesting because you want to make sure that you don't shave anything, ideally, so that, because that body is going to be around for a while. So my dad always threatened to do it, but we didn't end up doing it. So if you want to freeze dry and have your little cat there, on a bed, you can do that. You can also take samples for cloning now. So it's a kit that you order before your pet passes. I know it's so strange, but you order the kit and then you hand it to the veterinarian at that time. And then once your pet has passed, we then collect the tissues and then we send it off to the tissue bank. So there's that. There has been some talk of taxidermy. I've never actually had a client do it, but I know that there are some wonderful taxidermists out there. I mean, obviously they do foxes and that kind of thing. So, there is the option to do it. There's a lot of other neat things, though. I've seen people take the rabies tags or, the little tags and make bracelets out of it. There's tons of ideas on Etsy. Yes. Take the collar and make the collar a picture frame and then put the picture in it. Paw prints, all the families that we see get a paw print, no charge or anything. We always do that. And then make shadow boxes with a picture and the collar and the paw print. And, so there's so many wonderful things. There's even a couple companies that will make a stuffed animal out of your pet. No, that came out wrong. You send pictures of your pet and then there's a stuffed animal that looks like your pet. There's Cuddle Clones. And then there's another company that it's off the top of my head right now. But if you just Google it, you'll find it.
Yeah, sure. I've seen even ash jewelry, like jewelry where you can have the ashes, little pieces of the ashes. And then like in the equine world, I've even seen hair burned into different types of pottery and different types of jewelry. The thing about you can really embrace this passing and make it beautiful and memorialize it is really cool. So Dr. Dani, we're getting a lot of questions and comments in that I want to really make sure that we get to them too. And so one that I saw up here kind of in the beginning that I thought was really pretty cool was let me find it. We have a viewer who's doing a pet grieving certificate. And so she was asking, how can she use this for, it's Anita, for being proactive with clients. And so how do you leverage these folks that are out there getting, these certificates and these certifications that are actually becoming a part of the veterinary industry and helping people through the grief process? We're really starting to recognize, right, that this is a huge loss as much as a family member. Yeah. Are you utilizing and leveraging these types of folks?
Yes, yeah, absolutely. We have a team of close to 80 people that help us answer the phones for what we do. And at least a third of them are either CVTs, RVTs, veterinary nurses, or DVMs, actual veterinarians. Yeah. So we have a huge team. We are always looking for people, and we hire across the country. So yeah, I mean, we absolutely love that. I mean, obviously there's so much more you can do to start a pet loss support group. You really have to be very diligent with those. I see a lot of them pop up and start up and then they just stop. But you really need to get the word out, talk to the local resources, your clinics. Clinics love having somewhere to send people to. Yes. We're veterinarians. We're not grief counselors, although we do that part on the movies all the time. So, we really like to have that. Obviously, I've got a team of people. We have a full-time grief counselor on our staff. Every single one of our team that helps answer the phone goes through a training once a year as well. Yeah. So it is important. Obviously, I wouldn't imagine you would start something like that unless you knew, the plan and what you were going to do with it. There's also this amazing app that Lap of Love has been honored to be a part of. It's called Listeners on Call. It's an app that just got released, and it is basically like an Uber for listeners, okay? Crazy. Listen, I know it's crazy, but you can download the app, Listeners on Call, And then you can put, as if you want to be a listener, for example, you say, I'm really good at listening to people going through pet grief. Like, I'm really good at that. You can say, that's what I'm good at. You know, add in, like, I don't know, divorce or work issues or whatever, right? Yeah. So then you can put those little tags on there, and then you can actually, I think it's like $15 an hour or something. I don't know. You have to look this up, but you earn money by listening to people based on what you're really good at. So that's another way that you can use that certificate.
That is brilliant, and it's really nice to have something to that effect to offer for our clients, so we have somewhere to turn them. I kind of wanted to take a second to shout out the people who do cremation services, because I think they're the unsung heroes of the veterinary industry in a lot of ways, because they really do treat your pet with a lot of respect for aftercare. And I think that's one of the things people worry about the most. Yeah. I think they worry, will I get my real pet's ashes back? And will they respect them? And then how they return the remains with a lot of, like, I hate to say like mine, but you know, I'm a vet tech and we use the same, and I've lost a lot of pets, is they put a little, you know, bit of lavender, a poem. They really just make that experience as beautiful as they can. I know you mentioned paw prints. What are some other beautiful things you've seen clinics do out there to memorialize? Or, you know, I know sometimes in hindsight, people think, oh, I wish I did this. So what are some things for folks that you recommend before this time is coming to make sure they do, so they don't kind of wish they did it later? You know, pictures or hair. What are your recommendations?
No, that's great. I know we always recommend doing a pet photography session. I've never seen those not be appreciated, and definitely worth a couple $100. You know, the paw prints obviously are huge. They're really difficult to do. So if you can't figure it out properly, if it doesn't look good, then have the veterinarian or the team do it. This is actually my own pet's paw print also that I've worn for years. Yeah. And I sent found somebody on Etsy and sent her the picture, and we actually use that group now. We do it for all of our entire team gets one every year too.
Oh.
So yeah. So, you know, it's those little things. I mean, clipping the hair, obviously huge. I mean, I think you said it, the having photography, clipping some hair, and then the paw print, that kind of gives you options that you can do later on. I've seen people tattoo the paw prints, you know, on their arms and stuff. And I think it's beautiful.
It is. So that brings up another question. I'm going to see if I can find it in here. Somebody mentioned tattoos with ashes. So have you seen that? Oh, here we go. This was Adrienne. She thinks she wants to do that when the time comes.
Yes, I have seen people do that. Yeah, absolutely.
I don't know if that's,
you know what,
FDA recommended.
Listen, I don't know if tattoo. I'm gonna stick ink in my body, and I have a tattoo too, so I get it. Yeah. You know, but who knows? No, I mean, I think that the fact that it's there, you know, and there's no articles about how terrible it is. I don't think that's that big of a deal at all. I've also seen so there's this thing now called water cremation. You talked about cremation, but there's
aquamation. Yes, I was going to ask you about that.
Very, very cool. Listen, a body disintegrating into ash is a body disintegrating. I'm just going to say it right now. So whether or not you choose one or the other, I really don't have a huge opinion on either one. They're both great options. It's weird how some people can have like an aversion to your pet going in a vat of water, and then potassium chloride and sodium hydroxide, it disintegrates the organic material, you know, down to just that fine bone ash, you know, air quotes. Yeah. So some people are like, I don't want my dog being like in water though, and then like being, you know, dissolved away. I'm like, well, I'm not sure the fire is. Yeah. So it is what it is. Again, a huge personal preference. I will say with the aquamation, you can request the teeth back. And so with my little girl, Seiko, I got her canine teeth back, and I'm working from home. I have it in my actual office, back at the office. And not only that, I got her microchip back also.
Oh, wow.
I have a little jar with them. So that is an option that you have with aquamation that you don't have with the fire-based cremation. Well, what about the implants? Can I get the implants back, like maybe ACL or, you know, any of the orthopedic implants? Sometimes you can get them back with fire cremation. It depends on the metal that was used, and it depends on whether or not the cremation process was done at a super high heat or a little bit lower of a heat, because a lot of times, obviously, they're disintegrated, in the fire. Water-based cremation will allow you to choose to have those returned to you.
Wow. And also way better for the environment, right? I mean,
it is, yes. It's a basic water solution, so it's not like a vat of acid that the body goes into. It's actually the opposite level of the pH. It's a basic solution. So it's not bad to get flushed in the sewer. I mean, there's tons of regulations and stuff that you have to follow, but it's very good for the environment.
It is. And, Dr. Dani, honestly, I guess the last thing I want to say, just sort of as we go, I'm looking through these comments, is I can't say how many times we have performed euthanasia, and I guarantee you this is your case. We get all the food, all the cards, all the flowers. I get more thank yous for a peaceful passing than for miracle surgeries, 15 minutes of CPR. I have poured calories into dogs, bringing them back to life, cats. I've done CPR till my hand is numb.
Yeah.
You don't get a card or
like, it's because they expect you to do that.
Yes.
Right. You are expected to save a life. You are expected to do a radical surgery. That's an expectation.
Yeah.
But you're not always expected to handle something so drastic and so sad with compassion and love and empathy. And I think when we do that, it provides a gift to people that they weren't expecting.
Yeah. It's so true. And they'll look back with fondness, and they won't look back with like sadness. And through that, I have noticed through the comments here, I keep saying thank yous. Thank you for having this webinar. Thank you for helping me. I'm making this decision right now. And so this is an important topic, and it's a hard one to approach because it seems like such a bummer. You make it uplifting. You make it comfortable. You empower people. And what you do is absolutely beautiful, as beautiful and brilliant as you are. So thank you so much for making the time. You guys, lapoflove.com. Please say thank you to Dr. Dani. We love your pets. That's what we're here for, and we love them from day one to the last one. And Dr. Dani, thank you for helping not just our folks here, but thousands a month have these really important passings. So lapoflove.com, and thank you again, Dr. Dani, so much.
Thank you, Becky. Thank you.
All right, we'll talk to you soon. And you guys, thanks for watching. We'll see you again soon.